So my client is an older woman who recently endured a stroke, and that stroke did leave her hypotonic on the left side of her body, so it did affect the left arm and the left leg. So I am going to be introducing two different neurorehabilitation techniques that can be used to eventually increase participation in regular grooming exercises for the purpose of this client, specifically combing and or brushing the hair. So the first one I'm going to be talking about and discussing is are some basic PNF patterns. So I'm going to be demonstrating D1 flexion and D2 flexion, both of which will help to facilitate some of the movements that would needed to be performed during hair brushing or combing. So for D1 flexion, the client is going to start with their hand outstretched this way, palm facing behind them, and they're going to reach up across the body and finish here. And then for D2 flexion, they're going to start down, crossing the midline of their body with their hand in a fist, and then they're going to reach up with the hand outstretched, palm facing the ceiling, looking at that hand. So I'm going to demonstrate those one more time. And obviously you would want this client to perform both of those patterns using the left arm because that was the arm that was affected by the stroke. And then the other technique, I'm going to have to move this table around, is weight bearing. A lot of times hypotonic patients will not be aware of where their arms are positioned, and that can become a safety hazard when they're rolling in bed, because if they happen to bring that arm into any sort of weird or funky position, they might upset some of the muscles within the arm. So to kind of give them some sensory input, you can have them participate in weight bearing. So you would have them take that left hand and place it on a nearby table, mat, or bench, whatever you've got available, and then actually lean over it. You don't want their elbow to collapse, so you want to keep that lifted from the table, and you don't want them to be hanging on that arm, rather they shift their weight over top of the arm.